Blumberg, who's the radiation oncologist at GBMC, joins us. I'm confused. We're all confused. You say early detection. Why so late now at 45?
I think that these guidelines from the American Cancer Society, in a positive light, are saying that mammograms are important. Women between 40 and 44 should consider having mammograms, discuss it with their doctors. They're moving the yardstick back. The American College of Radiology, the Society for Breast Imaging, the American College of Obstetrics and Gynecology still say start at 40. I personally believe starting at 40 is important. I saw a woman today in consultation who had her first screening mammogram at the age of 41. She had a 6-centimeter area of malignancy in her breast. If she had waited till she had a palpable lump, she would be not curable. Today, she's curable.
Doctor, we put up a little screen earlier. One said 50, one said 45. You say 40. Some women are going to say, to heck with it, I'm not going in.
A lot of women are saying, to heck with it. When we were pushing hard that everybody should get annual mammograms, we never hit 100% in this country, but we're hitting in the low to mid-70s. We're now in the high 60s. These kinds of recommendations are just going to confuse people. I am seeing women in the last couple of years who haven't had mammograms in several years and are presenting with stage 3 and unfortunately sometimes stage 4 situations. That's all because the message people are getting is that mammograms aren't as important as I thought or was told, and therefore I can delay it. And you know, we all have busy lives, and you can imagine someone who's busy, if they skip a mammogram, say, oh, you know, I'll get around to it, I'll get around to it. Well, you know, maybe 2 or 3 years they get around to it, and then there's a problem.
Oh, man.
It's nuts.
What would be your goal? What would be your suggestion?
I tell people that they should start mammographic screening at 40. I believe they should have annual mammograms until perhaps when they hit 80, and maybe they don't have a life expectancy of 10 years. But I think it really has to be individualized in terms of what is that patient's risk factors. Does she have dense breasts? If she has dense breasts, there's a whole paradigm you have to follow in terms of evaluating what breast density does to impact it. You may be aware or followed the whole discussion that occurred in our legislature that said that we had to include the concept of breast density in mammogram reports, and that's because people weren't being told that they had dense breasts when they felt that they should have been told, and they were presenting with much more advanced cancers. And the whole issue, I agree with what you said earlier, early diagnosis means that we can find cancers smaller and more easily to treat. One of the things that recommendations like the ACS have come out with today ignores is the fact that by catching a cancer smaller and earlier, it allows a woman to consider breast conservation. She may still be cured if she's presenting with a more advanced disease because we have all kinds of fancy chemotherapies and immunotherapies for the appropriate setting, but she may have to have a mastectomy and reconstruction.
Were you blindsided by this report today?
Yes,
you sound
absolutely.
Frustrated and confused.
I am frustrated and confused because I couldn't believe the American Cancer Society felt the need to do this tweak, which they think is an important tweak, but I agree with what you said. People are just going to be more confused. Women are going to have less mammograms, and it's going to lead to more advanced cancers being diagnosed.
You're a titan of GBMC.
Thank you, sir.
Blumberg, and man, it's confusion, but listen to him, all right? Trust him.